The island country of St Kitts and Nevis in the Caribbean has seen no deaths from COVID-19. Only 15 people there have been diagnosed and none needed to go to hospital. In spite of this, the virus is still taking its toll on one of its main sources of income, tourism. And joining me now is the Prime Minister of St Kitts and Nevis, Dr. Timothy Harris. Dr. Harris, first of all, thank you for being with us. Why is it, do you think, that you have been able to have such a relatively mild outbreak of coronavirus?
I think, first of all, I want to commend our health planners who very early saw the pandemic evolving and took steps, set structures in place, began an effective public education program, and the results of which we are now being able to see with the mild infection rates we are seeing in my country of St. Kitts and Nevis.
And how's that reflected across your Caribbean neighbours?
Well, across the Caribbean region, of course, we are all challenged at different levels. But overall, I think, relative to some other regions, certainly relative to Europe, the Caribbean is doing reasonably well.
And one of the things, presumably, that you had to do was effectively shut down tourism and visitors.
That has been the reality of the world everywhere. In the context of a need to prevent the transmission, very early we took a decision to impose travel advisory and then ultimately to close our border to incoming traffic from abroad. The cases we have had have been import related, and so that become a necessity if we were to protect our people and our residents. We are working hard though, using this time to prepare for the eventual re-engagement with the world and to offer those who come the most awesome experience in St. Kitts and Nevis.
Yeah, I mean, because given the importance of tourism to you and to others in the Caribbean, this must be having a very severe economic impact, is it?
It is significant in terms of its impact. In fact, the whole world is being destabilized, and tourism-dependent countries are more significantly disadvantaged. We have thousands of persons put on the breadline. We have responded very quickly with a stimulus package that is providing income support to those persons who have been engaged in the tourism and other sectors impacted. So we are doing what we can internally do to keep the economy moving, ensure our public infrastructure program can at least boost in jobs in construction sector.
If you look around the world, the outbreaks are still very much close to peak in Europe and in the United States. So when do you think you're going to be wanting to welcome visitors from those countries?
Well, that is something that is a moving target. There's no vaccine. The safety of our people must come first, and that must come before every other consideration. Indeed, it not only behoves that all of us do what we can, because even if St. Kitts does continue to do as good as we are doing, and the rest of the world is lagging behind, then there will be no tourism. And so all of us globally have to be working in hand to achieve the goal of getting our societies back to normalcy or as near normal as soon as we conveniently can. And that is a priority now in St. Kitts and Nevis.
I mean, sadly for tourism, it looks like many months yet before it's going to get going, doesn't it?
It looks so. It looks so. And what it does is that it gives us time to deal with the health imperatives of a new brand of tourism, a new brand of tourism product, which we now have to offer, and to prepare our people, reorienting them to a new engagement with the people where health is going to be a principal concern as we open our borders in the future to the arrivals of guests who come to enjoy and experience our culture and all the other assets that we have.
What would that sort of shape of that new brand of tourism, as you call it, be?
Well, that is still something that has to be, is in a state of development by our tourism planners. But certainly you are going to see increased efforts in managing where tourists go within destinations, managing the kind of contact that one would have. How, for example, we move from a very intimate, touchy society to one in which some measure of social distancing would still need to be observed. How do we protect those workers in our hotel industry who are going to be very close up? How do we ensure that the natural assets that we have in our country are marketed appropriately and those become some of the principal destinations that will now draw the tourists that is coming for leisure? So those are some areas that we are looking at.
Dr. Timothy Harris, the Prime Minister of Nevis and St Kitts. Thank you very much indeed for joining us.
Thank you very much for having me.